Hi everyone, I'm Madison and this is Hannah and we're from North Carolina State University representing SenseNC from the United States of America.
And this is our translational potential pitch.
In 2017, the global biosensor market reached $17 billion. In 2024, the market is expected to reach $29 billion. That is a huge market, and we saw that as a great opportunity for innovation. We created a point-of-care device that contributes to this 47% market share. Hannah's going to talk further about the problem that we're aiming to solve.
A common issue in antibiotic delivery systems currently is that it's very hard to accurately deliver results to monitor the antibiotic concentrations in a patient's bloodstream effectively without a costly process. So monitoring vancomycin levels in a patient's bloodstream is essential to their overall health care of the patient, yet currently monitoring those levels is very hard to do it quickly and accurately. 30% of patients, when we talk to hospitals, 30% of patients undergoing this treatment with vancomycin potentially will undergo acute kidney injury. When we talked to the hospitals, the annual cost that they were undergoing was roughly $9 million a year, with 80% of this cost coming from the cost that they front based off of the liability of a patient potentially having acute kidney disorder. So by reducing the risk of acute kidney infection and by reducing the time that the staff spends with each patient per day, we offer an economic solution that is beneficial for the patients as well as the hospitals.
So how did we come up with this positive economic solution? We went to the industry firsthand and interviewed nurses, emergency room infection control managers, and pharmacology directors from the leading healthcare provider at North Carolina. From their feedback, we created a fast, efficient, and portable device that will allow doctors to frequently and accurately monitor their patients. One of the main features of our device is our mobile application. How many of you use a mobile application on a regular basis? So all of you that raised your hand would then be able to use our application. This application, patients will be able to download this, and they too will be able to see the results that the doctors are viewing. This application will allow doctors to test patients, read results, and perform treatment in minutes rather than hours.
As for our stakeholders, our biosensor offers a constant source of revenue. Our business model mimics that of the razor blade model, so our biosensor will be sold at cost, and our source of revenue will come primarily from the sale of our molecularly imprinted polymer chips. Some other advantages that our biosensor offers for the hospitals and patients themselves is, through the hospital, we offer higher productivity because the staff no longer has to spend as much time per patient per day, as well as they get immediate results through the use of our app. For both the patient and the hospital, we will reduce the risk of acute kidney infection, which thus reduces the amount of time the patient will be in the hospital and also the cost that the hospitals are fronting. Surely we can all agree that a movement towards modularity is essential and a trend towards cost sensitivity is in demand. SenseNC is offering the optimal biosensor at the best cost, technology and design that we can offer. Now we'll take any questions if you have those. Thank you. Yes. So the question was that we stated that the patient would be able to see their vancomycin levels in the bloodstream. That was mainly just so the patients feel like they know exactly what's going on with them. So it's mainly going to be used for doctors. They can see exactly what they're seeing, and they'll know what that number means. But patients will be able to see it and know, hey, that looks a little different. And I'm sure there will be conversations between patients and their doctors so they understand what those numbers mean. Because they're going to want to know what's going on in their body. They're going to want to know what the doctors are seeing. So I believe that channels for the doctors and patients to have more interaction. And we have the app on a phone. I don't know if you guys got to see it when you walked around. It explains a lot more if you see it in person. There's a lot of stuff that the patients can use as well as the doctors that is informative. So the plan with our technology was that we're going to have the biosensor be sold at cost, and then the molecularly imprinted polymer cartridges can be tailored for different uses. So for this example, they're used for antibiotic recognition of vancomycin, but the hope is that we would be able to tailor those to other recognitions. So maybe a hospital isn't using it for vancomycin, but they can use the biosensor for something else based off of the electrochemistry in the sensor. So there should still be a market for it. We'll sell it at cost for the biosensor, but either way, the biosensor should come out to roughly $200 for the biosensor itself. And then the cartridges will be about $3 to $5 each. So that's kind of the current razor blade model that we have.
Liability costs in the US are typically very high compared to Europe. How does that fit into your business model if you go into non-US countries?
That is sorry, I didn't repeat the question. He asked, with the liability cost is very high in the United States, he asked if we went to a European country, for say, how that would affect that. So we didn't exactly look into European countries, which we realized that is probably not the best move since we're from America and we're the only American country here representing. But do you have anything to add? What would you think as far as the European liability? I think we add more value than just the monetary value. I think the fact that it's quick and accurate really helps with the time. It's a unique value in the fact that it will increase productivity in hospitals no matter where. So the European hospitals may not be fronting that liability cost as much as the United States is, which is where the majority of our target was for the US. But it offers the fact that we have the app, so there's communication opportunities, as well as the technology can be tailored elsewhere. Yeah, did you have anything to say? Any other questions?
I was struck by the figure about 30% kidney infections.
Mm-hmm.
Can you please look it up?
Yes, so that number actually, so the question was the 30% acute kidney. Yes, it's very high. We talked with hospitals, so like Madison mentioned, we talked to UNC Rex, which is the largest healthcare provider in North Carolina. We talked with them and they gave us the majority of the numbers that we got. So 30% came directly from them, from their sources when we talked to them.
I think that's acute kidney failure in an ICU setting for patients on vancomycin, but that's not vancomycin attributable acute kidney injury, and that's a different number. So,
Okay.
But still, the problem is there.
Yeah. Yes.
Any other questions? Otherwise, we'll invite the last group. Yes? Okay.
Thank you.